And welcome to Talk of the Town. I'm Robyn Zimmerman. Lourie has joined us. He is the president and CEO of Lourie Life and Health. It's an organization, an agency that serves folks throughout the entire state of South Carolina. He's actually coming from Columbia, long line of public service with his father and himself. Joel, it's so good to see you.
Hey, Robyn, thanks.
Yeah.
Thanks for having me.
Right. Let's just jump into your company and the services you provide. I know we're going to get into, of course, health insurance and open enrollment, but tell us a little bit about your company.
Sure, be glad to. And as you mentioned, I was honored to serve for 18 years in the House and Senate, and healthcare was always a really big passion of mine. And Lourie Life and Health is just a way to extend that work in the private sector. Essentially, what we do, Robyn, is we provide advice, consultation to help consumers enroll in the most affordable and efficient healthcare plan for their needs and budget. So that can be in the under 65 market, whether it's an individual, a family, or a group, or in the over 65 market with Medicare. There's so much going on. There's so much noise, particularly coming out of DC. It's very confusing. We think it's important that people deal with a local agent and a local agency, and that's what Lourie Life and Health is all about.
Okay, great, Joel. So specifically in Beaufort and Jasper counties, there are changes in Medicare Advantage during this open enrollment and some plans that are being discontinued. You want to share about that?
Yeah, absolutely. It's critical. The Medicare Advantage market, Medicare Advantage is a very popular product for people that are on Medicare. But in the last couple of years, we've seen what we call service area reductions, or a plan that may be offered in 2025 specifically is not offered in 2026. And it affects a couple of thousand people in Beaufort and Jasper counties. There's a couple of plans. So they should have been notified by their insurance carrier that that plan is going away. But if your viewers, Robyn, have any questions, they can call our office. We have a Beaufort number, 843-278-9567. Again, that's 843-278-9567. We can assist them over the phone. We can quickly review their plan. If they want to look at the additional options, we can do that over the phone. And the good news is that we are local. So in the future, if they have questions or problems, we're going to be there to assist them every step of the way.
Okay, perfect. And you mentioned your changes at the national level too, Joel. So anything you want to share about the Affordable Care Act in the coming year?
Yeah, man, I'm so glad you asked that. So Medicare enrollment ends December 7th. Health insurance, or the ACA, Affordable Care Act, ends December 15th. You can't read the news without reading about the debate going on in Congress with regard to the subsidies. And these are subsidies that make health insurance less expensive for hundreds of thousands of South Carolinians. We are waiting to see whether Congress extends these deeper discounts or not. So we are on the phone. I think our office took in several hundred phone calls yesterday advising people on what's the most affordable option today and what that could or could not look like in the future. So this is a very tricky question right now, Robyn.
Right.
And again, if people have questions, the best thing to do is just give our office a call. Medicare enrollment ends the 7th. Health insurance enrollment ends the 15th of December.
All right, Joel, what are some of the themes that all these calls that are coming into your office with this complexity of health insurance and Medicare and so many options for folks? What are some of the major questions or the themes that you and your team are seeing?
Yeah, that's a beautiful question, Robyn. So on the Medicare side specifically, is that plan still being offered for 2026? And then the next thing we want to do both in Medicare and in health insurance, Robyn, is we want to look at your prescription drugs. We want to look at your doctors and make sure they're covered in the plan you select. Sometimes these networks of physicians can be a little bit of a moving target. And so our job as an independent agency is to represent the consumer, not be tied down to one specific insurance company. And we're going to double check and make sure all of those things fit so that your prescription drugs are covered, your doctor's in network, and you've got the most affordable plan for your personal situation for 2026.
Very good. So at the end of the day, you're looking out for the consumer, right?
It's what we do. It's what I was honored to do at the State House. And I love the team we have here at Lourie Life and Health. We do this every day. It's a real passion of ours, and we'd be very excited to help anybody in the Lowcountry of South Carolina with their decisions.
Well, thank you so much, Joel Lourie with Lourie Life and Health. Happy holidays to you.
Thank you, Robyn. Good to talk to you.
Okay, good to talk to you too. Thank you.